3 minutes to make sure you post your question on the WeChat. We are going to be using your questions in a little bit. So thank you for those of you who have posted them on the WeChat. And for those of you who haven't, you get the next 3 minutes to do so. Write your question down. And when I get a thumbs up from you guys, then I'll know that they're all in. Hmm. 'Say that one again.
The question is, compared with those who did not take metformin, how many type 2 diabetes patients treated with metformin will develop a cancer? So I wouldn't ask the question that way, but yeah. So,
just gotta help people break things into smaller questions.
I'm trying to think.
Because the other problem, some of these are, they're like 4 questions. Where's your first question? Does that inform something else?
Are they still coming through?
Yeah, I was just wondering that whoever asked this question on the right, I don't think they said that.
They entered it in?
Yeah.
So if one of your questions was the one on the board, make sure you enter that in the WeChat also.
I'll put it in. So the ones on the board, you have it written out differently?
All right. Stand up if your question is in WeChat. Keep standing if your question's in WeChat. And if your question's not in WeChat yet, then maybe we can walk around and make sure you get that done. Ling Yi, do you want to see if you can? Ling Yi, do you want to see if you can maybe help folks? You got 12 questions. Got it. Good.
Everybody else, 你们有没有问题？还是你们没有问题？还是你们知道怎么写问题？ You just gonna keep them standing?
Yep. Well, everybody should be standing by the end of this. I'm totally good with awkward silence.
还有吗？你们现在想你们的问题，放在这个微信里面吗？
All right. Raise your hand if you don't plan to put a question in WeChat.
举手，如果你们也有问题的话。
All right. Everybody's planning to do it. Okay. You don't plan to do one. Okay.
有一个人，你们所有的人都有问题，对吗？
So do we need more time?
我会放在微信上面，这个群上面。Okay, we got one more. Jenny, your turn. I noticed you stand up. Once mom who has HPV, which of their kids go on and develop HPV? 还有呢？还有呢？还有呢？ Yes. Either they should be on their phone right now or they should be typing on their computer. One or the other, right? 你们两个别不要写问题。你们呢？有没有问题？放在这个微信上面。没有，没有。OK。你们呢？现在写，没什么。现在写。你们呢？没有问题，没有问题。如果你没有问题的话，举手。可以吗？你知道谁没有问题，所以你可以举手嘛，因为你没有问题，对吗？
I think they have more questions coming in the chat.
Oh, cool. See? So 如果你写了问题就起来。如果你现在加了问题起来。如果你没有问题的话，举手。OK？ 高一点吧。对，我们可以看到啊。还有另外的所有的都是在微信里面加问题，对吗？ Yep, they're all on their phones. So they must be typing. You can see WeChat. So
Give them.
this is like that's a trick trap right there. Our side was a trap, man. Your side is a trap. Just
So we
don't
should
go down that thing.
give them one more minute then? 'Cause it looks like.
No, a bunch of them are coming in.
Okay. Okay.
A bunch of them just started showing up. 多1分钟，加你们的问题吧。你们有没有问题？现在写完了就起来。活动一点吧。来 stand up for a little bit, it's good exercise. 现在写，在这个微信上面，所以 So either they're writing or they're trying to figure out what's right. And they see a bunch of them and
Like what? Scared him off.
Yes, totally. All of the human being. More questions. Wow.
You can have some more if you want.
But you can ask the class.
More questions. Fine. Oh, 这个目标。你要写问题，在这个微信上写起来。如果你没有写的话，就写吧。或如果你没有问题的话，就举手。So， 你的手要高，很高。It's called exercise, right?
Is that probably good enough?
Yeah, kind of bit, yeah. Kind of bit will come in. Probably another 10-ish or so we're looking at about 25.
That's fine. We're probably good enough for now.
Yeah, because I don't think we're good.
All right. So, for those of you who are standing, because you've put your question in, now what I want you all to do is if you think your question is the best question ever, then I want you to wave your hands. Who's got the best question ever? You have the best question ever? What was your question?
My question
Is
Totally the best question ever.
is children with congenital heart disease also have a bad influence in their brain development?
I'm sorry, it was loud. Can you say it again?
Do the children with congenital heart disease
Children with heart disease?
also have a bad influence in their brain development?
Development, okay. So the outcome is development after children having congenital heart disease.
Yes.
Very good. All right, who else waved their hands? Yes. Simplest is good. What is it? Okay, excellent. So we've got amongst patients with breast cancer, what treatments are those patients choosing? Excellent. Okay, who else is waving their hands? Yes.
I worked in the hospital before, and the question was from my clinical experience. The question is whether people with traumatic brain injury have an improved fracture healing.
With traumatic
Brain injury
brain injury,
have an improved fracture healing.
fracture heal rate? Healing. So that having a traumatic brain injury heals you better?
Maybe.
Really?
Yeah.
Okay. Okay, very cool. All right, and who else thinks their question's the best? Is that everybody? Excellent. Oh, we got one more. Yes.
One more question is about endometrial cancer.
Endometrial cancer, okay.
I wonder those patients with endometrial cancer who more likely to develop lymph node metastasis.
Okay, so amongst patients with endometrial cancer, who goes on to develop a lymph node metastasis?
Yes.
Excellent, very good. So we've got a characterization question, we've got 2 prediction questions, and then we have an estimation question about the effect of traumatic brain injury on healing rate. Okay? So we've got different types of questions, and all of those are super good. We're going to go through all of the other ones that you've typed into WeChat, and for the couple of you who still haven't gotten it done, please go ahead and finish them into WeChat. You guys are standing, you can now sit down, thank you. The reason why we wanted to take this time to have you define your problem is because this afternoon what we're going to spend the next 2.5 hours on is helping you now take the next step, which is to go from your research question, which you wrote down as a sentence, a series of words, into how do we define these into cohorts, being the specific criteria that we're going to go use to find the patients in observational data that satisfy our research question. So just using the example of endometrial cancer and lymph node metastases, we now have to be able to take that sentence and translate that into how are we going to go find people with endometrial cancer? How are we going to go find people with lymph node metastases? So now we're going to take that next step and actually define that in an analysis. Okay? And so as we go through this as I go through this next part of the lecture, I want all of you to be thinking about your own research question and thinking about how every step of the process I'm going to describe, how it applies to you. And actually, yeah, I want to hold on to that. I'll hand that out in just a second. So I think I'm still employed by my same company. I haven't been fired over lunch, or at least I haven't received the email yet. Okay, so what we're going to actually talk about today is we're going to talk about designing cohorts, so how you actually need to perform a cohort. You're going to get to implement this in Atlas. So the same tool we used yesterday, you're now going to get to, Kristin's going to walk you through the step-by-step instructions of how to create a cohort. So you'll be using that same username and password that you had yesterday. As time permits, I might talk to you a little bit about how we evaluate the cohorts to make sure that you know how to interpret them. Okay, so we're going to be spending a lot of this afternoon talking about creating cohort definitions. Another word that you will commonly see in the medical literature, particularly in the informatics literature, is the word phenotype. And so throughout this lecture, you may hear me say cohort or phenotype, and that are two different words that mean the same thing. There's a very nice published paper that was published by George Ripsack, who is the chair of the OHDSI Coordinating Center. And he, in this paper, defined what a phenotype was. And specifically, he defined it as a specification of an observable, potentially changing state of an organism. And this is to be distinguished from a genotype, which is derived from your genetic makeup. He said that a term phenotype can be applied to patient characteristics from electronic health record data, and that our goal is to draw conclusions about a target concept based on the raw EHR data, claims data, or other clinically relevant data. And so phenotype algorithms, or synonymously cohort definitions, those are algorithms that identify or characterize phenotypes, may be generated by domain experts or knowledge engineers and through diverse forms of machine learning. What we're going to focus on today is the idea that the phenotype is the disease that you are interested in trying to study, endometrial cancer as an example. And the phenotype algorithm, or the cohort definition, that's the way we're going to go into data to try to find the people who satisfy the phenotype. So endometrial cancer is the idea. Finding people with a diagnosis code in the condition table of the code endometrial cancer, that will be the algorithm we will use to define the idea. So all of you should have a research question now that has one or possibly two different phenotypes that you're thinking about for your question. And for each one of those phenotypes, I want you to think about that we're going to create a phenotype algorithm or a cohort definition, which is the strategy to use data to find those patients. There are two main ways to come up with algorithms for phenotyping. We're going to spend all of our time on the first one, but to just to highlight them separately, there is the idea of rule-based phenotyping, which is that what we're going to do is we're going to define a specific set of criteria where we're going to say if a patient satisfies some criteria, we believe they belong to our phenotype. And if they don't satisfy those criteria, we exclude them. On the basis of this, a rule-based phenotype decides, based on our own logic, whether a given patient qualifies or does not qualify to belong to the cohort. An alternative approach to this is probabilistic phenotyping, which is the idea that you allow statistical algorithms to try to uncover which patients belong to the disease of interest. And usually in those cases, the algorithm is assigning some sort of probability that a person has a disease or not. These are two different strategies. If anybody is interested in learning about this second one, we offer an entire class in this, and there's a lot of really neat research. This is more for those of you who are interested in statistics and data mining and machine learning type of work. For those of you who are medical students, the thinking about a rule-based phenotype will largely be exactly the same type of training you do to, for example, perform differential diagnoses, where you say, has this condition and has this lab test and had these prior treatments, therefore has the phenotype I'm interested in. That's the kind of thinking we're going to be going through today. Oops. Okay, so this is where we now have to connect your idea to what data exists. And this is why Ling Yi's presentation yesterday was so important. Because what Ling Yi presented was all of the tables that were in the OMOP Common Data Model. But now you need to think about those tables as representing types of data that we might have available to us. And the main types are shown here. You have conditions. So those would be your diagnosis codes that a doctor is going to be writing down that suggests what a person's medical history represents. You have drugs representing the treatments that patients have been exposed to. You have procedures that have been administered. And importantly, there are really two types of procedures that we should probably think about. There are diagnostic procedures. So what types of procedures do you perform in order to determine that a patient has a disease? And then there are also therapeutic procedures. So what do you do to a patient once you know they have a disease to try to treat it with some sort of intervention? We have measurements. Measurements are primarily laboratory values and other vital signs that may be captured. We could have other types of clinical observations like smoking status or family history. And of course, you also have the fact that patients have visits. They go to their doctor. They're admitted to the hospital. And the fact that visits take place can be important measures of care. I don't actually know if the analogies are Legos a thing over here? Okay. So I don't know. They're a big thing in my household because I have a 3.5-year-old daughter. So I spend a lot of time playing with Legos with my daughter. The reason we talk about this as Lego bricks is because what you're going to be doing is taking your phenotype, that idea of the disease, and now you need to be thinking about which of these Lego bricks do you need to stick together in order to find the people who have the disease. Now, there's a bit of an irony to all of this, which is that an electronic health record database is supposed to be the way for us to write down which diseases which patients have. So it should be easy. If I write down that a person has endometrial cancer, then I should just be able to recover that they have a condition of endometrial cancer. However, we know that the data that most systems capture is not entirely reliable. It might be the case that you write down endometrial cancer, but the patient doesn't actually have it. That might happen because, for example, maybe the clinician has a suspicion that the person has the disease, so they wrote down they might have endometrial cancer. So they write it down as a suspicion, but then it turns out later that that's not true. The other possibility is that the condition might not be recorded, but all of the other indicators in the data suggest that the person actually does indeed have the disease. For example, if I tell you that a patient has had the drug metformin and has a laboratory measurement of a hemoglobin A1C greater than 6.5 and has a bunch of visits to a diabetologist, I don't need to see a diagnosis code of type 2 diabetes to know that patient is a diabetic. And so you want to think about these building blocks as a way that we're going to combine the evidence together to find the patients who have the disease. The challenging part is that the more requirements that you assign, the higher the likelihood is that the person probably has the disease of interest, but also the likelihood that you're going to now be disqualifying people as not having the disease because you've required so many rules. So, to use the diabetes example, a very broad definition could be somebody has to have a diagnosis of diabetes or a treatment for diabetes or a measurement of hemoglobin A1C greater than 6.5. That would be very broad and encompassing of likely almost everybody who has diabetes. However, we could have a more specific definition which says have to have a diagnosis code and has to have a treatment and has to have a hemoglobin A1C greater than 6.5. Now, we will have a smaller number of people who satisfy all of those criteria, but we're probably more confident that those people have the disease. With every cohort definition that we create, there is not a right or wrong way to define a cohort, but what's very important is that you clearly communicate what rules you followed in order to find the patients, and you think about what is the consequences of the way that you combine together these Lego bricks to find the patients that you're interested in studying. This paper was published in the Journal of the American Medical Informatics Association, and I like these pictures. You don't need to be able to read the numbers. I can explain what these are showing. Every color here represents a different type of Lego brick, okay? So, in fact, I can't even, let's see, if I show it on the screen, I'll be able to highlight a little bit better. So, for example, the purple color that you see here are medications. The yellow color are diagnosis codes. The green color are free text notes that are written down. Okay? And what these Venn diagrams are showing you is for different diseases, they ask the question, which Lego bricks are most useful for finding the people that have the disease? And so actually several of the ones that you guys are interested in studying are on the screen, so I'll point them out. Atrial fibrillation. What they found was the best way to find people with atrial fibrillation was to use the medications. And then here are the people who had the diagnosis code of atrial fibrillation. And you can see the overlap between those. So if you only looked for atrial fibrillation using the diagnosis code, you would miss a lot of people. And if you only used the medication, then you would miss a lot of people. But if you required both of those requirements, there's a fairly small intersection. So in this particular case, it raises the question, which of these Lego bricks would you like to use to define atrial fibrillation? But you can notice that this picture is quite different from some of these other diseases. So for example, this one is Alzheimer's disease. And here, it was determined that the majority of the cases that were found were required looking in the free text clinical notes to find Alzheimer's disease. Here's breast cancer. So how would we find breast cancer? Your question was amongst patients, correct me if I misremember it, amongst patients with breast cancer, what first-line treatment do we want, or what treatment do the patients take? Well, this paper found that in order to find people with breast cancer, the majority could be found by a diagnosis code, but actually a large number of people had to be found using notes, and medications for breast cancer represented a very small fraction. And that's likely because many chemotherapies are not specific to breast cancer, but instead are used for many different cancers and therefore are not specific markers for the disease. What you can see is different diseases require different combinations of Lego bricks, and each one can differ in terms of its importance. The reason I'm spending time talking about this is because way too often, I would say greater than 80% of the medical literature, somebody makes the assumption that the way to find people with breast cancer is to just look up people with a code of breast cancer. Or the way to find people with atrial fibrillation is just to look up people with a code for atrial fibrillation. And while that can be an approach that one could take, and we will show you how to take that approach, you need to think about the fact that the data that you're using might have additional pieces of information that can help you come up with a better definition for your disease than just a single diagnosis code. And in fact, when we talk about evaluation later, you'll see that in fact, using a single diagnosis code will get you the wrong answer a fair amount of the time. Now, when we talk about diagnosis codes, it's important to note that there is not just one code for a given disease. Yesterday, you got the experience in searching in Athena and also in Atlas to look for codes. You may remember when you looked for atrial fibrillation that there was many different codes for atrial fibrillation. There was proximal and several other more specific codes. This is a published paper that was on congestive heart failure. And what these authors showed was if they went into the database and they looked for specific codes in combination with specific laboratory values, they wanted to understand what patients were found by different criteria. And this very complex Venn diagram shows you all the combinations of putting together the Lego bricks depending on which codes you use and which laboratory values you required. And what's notable about this is each and every one of these letters that are shown there, that's a possible way of doing a study. So it is impossible for us to say that there's one correct way. Instead, it's important to know that when you're using data, it is not enough to say, I'm studying endometrial cancer. It's important to say, I have defined endometrial cancer using the following combination of criteria. And if you don't provide the full specification, then if I were to take your research question and try to do it myself, I would probably come up with a different way of defining the same idea, which would then mean I might get a different result when answering the question. So for the purposes of precision and reproducibility of science, it's very critical that we're able to define a research question down at the specific rules that we're going to follow. So this is why in Odyssey we've spent a lot of time trying to be very precise about what we mean by a cohort. It's this precision in the way that we're working through this that enables us to be able to take your research question and get us to be able to write a paper by the end of the next 3 days. But it also means you have to follow the rules. You have to be able to do the steps that we're describing all the way through, because if you are ambiguous in what you do or do not provide a full specification, then we can't execute an analysis from start to finish, which is why we have to follow these rules. So a cohort, this definition, you'll probably hear me say it a dozen times by the end of the week. A cohort is a set of persons who satisfy one or more inclusion criteria for a duration of time. I'll say it again. A cohort is a set of persons who satisfies one or more inclusion criteria for a duration of time. This definition is very precise and it has several consequences. One consequence is that one person can belong to multiple cohorts. I could be a person who has endometrial cancer. I can't be a person who has that. I could be a person who has diabetes, and I can also be a person who has hepatocellular carcinoma, because those are two different cohort definitions, and I could independently qualify for both of those groups. One person can belong to the same cohort at multiple different time periods. So thinking about your conditions, nobody was doing an acute disease, or maybe they're on the list. Is any of the examples a acute condition? No. Okay. So let's take influenza. You may have the flu during the year, and then it goes away. And then next year, the next flu season comes back, and you might get the flu again. So you can have a disease, have it go away, get a disease again, or have it go away. Importantly, we could also talk about a cohort based on exposure to a product. So if we're interested in the breast cancer example, and we're interested in what treatment, there could be a period of time that a patient was taking tamoxifen, and then they stop treatment. And then later they might resume treatment. And so you could enter a cohort, exit a cohort, and enter it again. But a person cannot belong to the same cohort multiple times during the same period of time. You either are in a cohort or you're not in a cohort at every moment in time. You belong or you don't belong. This is important because we're going to be using whether or not you're in or out of a cohort as our specification for all of our analyses. One cohort can have 0 or more members, meaning patients that satisfy the criteria. Now, this sometimes confuses people, so I'll try to provide an example. Earlier today, the question was raised, how do you know whether you've asked a good question or not? And one of the parts that I mentioned was, you could ask a good question, but the data might not be available to answer it. And so you could have a fully well-specified cohort definition to find the people you need, but when you apply it to a data set, nobody satisfies the criteria. Let me look at, do we have an example of one that you know off the top of the head we know we can't do? Wasn't there one about the questions?
You mean like the question that's...
Yeah, there was like one of them that I saw. Oh yeah. So earlier we talked about lifestyle treatment for uric acid. So that was a very well specified problem to be interested in lifestyle choices that could be used as an intervention for reducing uric acid. The question becomes, so we could create a criteria that said, find people who have an observation of, a measurement of high uric acid, and have an observation of this lifestyle intervention to change their uric acid production. The problem is, so that's a well-specified question. The problem is most data sources will not contain the information of whether or not a patient has that lifestyle intervention. So therefore, good question, well-specified, results in 0 people. I suspect, as we go through this afternoon's exercise, that at least one of you is going to come up with has a good question and will define it correctly, and you will get 0 people. It doesn't mean you have a bad question. It means the data can't support your question. And that's an important distinction that I want to draw. The last one's probably less relevant for you, but I'll just mention it. When you read papers in the medical literature, all too often you'll see something that says, we found patients with diabetes based on ICD-9 250 star. And they'll just express the idea of the phenotype based on a code set that represents the disease. A code set is not a cohort. And the reason why this is important is because you have to be able to specify, under our cohort definition, the span of time that someone belongs, which means you need to know when did they enter the cohort and when did they leave the cohort. Just telling me a list of diagnosis codes doesn't tell me how did I get in or how did I get out. So that is an incomplete specification of a cohort definition. Oops. Okay, so I'm going to looking at the anatomy of a cohort definition. Given that the definition of a cohort is a set of persons who satisfies one or more inclusion criteria for a duration of time, then what that means is, if we were to think about a given patient and their timeline of data, we have to be able to define a cohort entry initial event. So this is the moment you enter into the cohort. And we also need to be able to define a cohort exit event. So what gets you to leave the cohort? Once we've identified what enters you into the cohort and what exits you into the cohort, we can also apply inclusion criteria, which will filter us down to the patients that we're interested in. I'm very precise in using the phrase inclusion criteria. Many of you who have read published literature might be familiar with seeing people talk about inclusion criteria and exclusion criteria. We deliberately are going to define everything as an inclusion criteria so that we're precise in the way that we're using our language. But to be clear, an inclusion criteria could be something like must have a prior diagnosis of a disease, but another inclusion criteria could be does not have a particular disease in their medical history. So that idea of inclusion and exclusion criteria is something that we can specify formally as some set of inclusion criteria. Okay. So why does this matter? When we define our cohort entry definition, this is the moment in time there's a piece of data in a data source that's letting you know that a person might belong to your cohort. That is going to be the moment that's going to be the moment in time that we would consider to be our cohort start date. And once we have that date as an anchor, we can then apply our inclusion criteria relative to that date to be able to say whether or not at that point in time they satisfy the additional inclusion criteria that you might be thinking about. Your cohort exit criteria also is going to be some sort of event that takes place, whether that be observing that something else has happened, or possibly, the stopping of something, like the end of drug treatment, for example. Every single cohort definition we are going to define has to have all of these pieces. Not all of them are going to be used in all of your research questions. So, for example, your breast cancer characterization study, we care a lot about when you start being in the breast cancer cohort, because that's when we're going to start looking for treatments. We don't probably care about when you leave the breast cancer cohort for the purposes of your question, but we're still going to define logic to find it because someone else might want to do research on breast cancer, and they can reuse your same cohort definition to answer their question. Many times with diseases, particularly chronic diseases, the idea of cohort exit seems a little bit odd, because once you have a disease, you have the disease generally for the rest of your life. In which case, the cohort exit criteria could be the same as your observation period end date. Basically, you stay in the cohort until you're no longer in the database. And that's perfectly fine too. So, the questions that you need to answer when defining any cohort are really quite simple. It's what initial events define your cohort entry criteria, or your cohort entry? What inclusion criteria are applied to those initial events? And what defines a cohort's exit criteria? Lee, would you mind just passing these out? Thank you. So Lingyi's going to pass out a piece of paper for you. And it is just a worksheet that we use to create cohorts. And it is simply asking these 3 questions over and over again. You got one on both sides of the piece of paper. Now, the reason why this is actually important is we're going to show you, Kristin's going to show you how to go into Atlas and create cohorts. But I can tell you, and I still do this myself in every research study I ever do, I don't start by jumping into Atlas and writing a bunch of programming code. I start by answering these questions. So if somebody comes to me and says, I want to do a study of endometrial cancer, we start by having the conversation, what's your entry event, what's your inclusion criteria, and what's your exit criteria? You can attest the conversation we had last night. You started with a good research question, and we went through these exact same questions to say, how do we get down to the specifics that we need? And so, no matter what your research question is, no matter whether you're doing a characterization study, a prediction study, or an estimation study, every single observational analysis you're going to do starts by defining cohorts, and your cohorts all will be defined on this piece of paper. Okay? As long as you can get comfortable answering these questions, you're going to get really comfortable being able to do high-quality observational research. So, I want you to be thinking about your own research question, and I want you to pick one of the phenotypes that you have to do for your question, and I want you to be filling out this form. I'm going to just give you a couple more pieces of thought about these individual pieces, and then we're going to dig into this. So, cohort entry. These are events that are recorded as time-stamped observations for a person, and it could be any of the Lego bricks that we talked about. It could be a condition, or a drug, or a procedure, or a measurement, or a visit. It's a moment in time something happens to a patient, because that moment allows them to enter the cohort. Now, why am I making such a big deal about this? At least 3 or 4 of your research questions that you posed asked this question about comparing a group of people who took a treatment to people who didn't take a treatment? Raise your hand if that was kind of one of your questions. Some comparison to not using a treatment. Raise your hand. Got one over there. Got one person who's willing to admit they did that. I know there's like 3 or 4 of them, so somebody's not raising their hand. Okay. So let's just think about the. So it makes perfect sense that you would want to ask that question. People who take a drug compared to people who don't take a drug. The challenge that we need to think about is, what is the moment in time when a person doesn't take a drug? What is the date that you can assign of the date that someone didn't take a drug? Because if you didn't take a drug, that means I didn't take a drug yesterday, I didn't take a drug today, I didn't take a drug tomorrow. And so I have to think about, how am I going to define this moment that I enter a cohort? A cohort of people who are not treated is a challenging thing to think about. Exactly when did they make the decision to not be treated? There are ways around that. There are ways you could think about that. For example, defining the population as, let's not enter them when they start treatment, let's enter them when they have the disease of interest, for example. Because at least that's a moment in time that you can follow somebody. But it's important to always be thinking that every cohort entry requires something that happens to get you into the cohort. Yeah, I think that's fine. Depending on how sloppy Kristin and I get in our language, you may hear us use this phrase index date as this moment in time that we'll oftentimes talk about things. And in Atlas, you'll see us use that language very specifically. So the index date is your cohort entry start date. So that date becomes a magical number. And I showed you a cartoon earlier this morning where I said that date matters because your question either has to do with what happened before the index date or what happens after the index date. But being very precise about what this index date is extremely critical to asking good research questions. What's that? Can I get the Skype? I can open up Skype. Do I need to open? Oh, okay. I'll pull it up after I go through the slide. Perfect. Yeah. Inclusion criteria. Inclusion criteria are applied to those cohort entry events. So if we think about these as Lego bricks, you've got to start with a Lego brick that you're starting with as your anchor point, so that you can then add extra Lego bricks on top of that one. And so if you are defining a phenotype and you have created some cohort entry criteria, then you might have additional inclusion criteria that you are going to apply, which need that index date to decide what events you are observing relative to the index date. The most common type of inclusion criteria that are very often used is to look for the presence or absence of drugs or conditions or procedures in someone's prior medical history. So, for example, if I'm interested in studying, I'll use one of the endometrial cancer or breast cancer, actually both of those are good examples. One of the things that's most common in research in cancer is to be clear that the cancer that you're looking for is the first primary cancer that a patient has and does not represent some secondary cancer or metastasis from another cancer. So one might define a cohort as their cohort entry is the first time they had a diagnosis of breast cancer, but an inclusion criteria might be must not have a diagnosis of any other type of cancer any time in their medical history. Meaning, looking before the index date, let's make sure that we have 0 diagnoses of any other cancer. That would help us have confidence that the cancer that we're looking at is likely the first cancer. If we wanted to be even more specific, we might say, let's also make sure that those patients have never ever been treated with a chemotherapy agent any time in their prior medical history. Because why do you get chemotherapy if you don't have cancer? There, it's important to know your index date to know that we would not expect to see chemotherapy before, but we do expect to see chemotherapy after, because that will be the treatment for the breast cancer that we're interested in studying. In pretty much all clinical trials, the study protocol contains a long list of inclusion and exclusion criteria. And that's exactly the same kind of logic that we go through here. And as we can show you, it's possible that your cohort that you're writing on this piece of paper could have many, many criteria, dozens of criteria, hundreds of criteria. But also you can create a cohort with 0 criteria. You could just define your people as people with a diagnosis of endometrial cancer, and that could be good enough. It's highly variable, but by knowing what these criteria are, you can actually evaluate the impact of those criteria. You can look to see what happens in the data when I add on these requirements of these extra Lego bricks. And in fact, one of the powerful parts of the Atlas tool is actually quantifying exactly the consequences of the choices that you're making on this piece of paper. Your cohort exit criteria. This signifies when a person no longer qualifies for cohort membership. You can define it in a lot of different ways, and sometimes it will not matter for your research question, but nonetheless, it always needs to be defined. Importantly here, you should think about your phenotype and just ask yourself the clinical question, is it possible for someone to belong to your cohort, disappear from the cohort, or leave the cohort, and then return back? Is that clinically possible to happen? For some diseases, once you get the disease, you have the disease forever, so it does not make sense that you would enter and exit and enter back again. But for other diseases, it can make a lot of sense. For example, if we talk about breast cancer, you can be in remission of breast cancer and be clean for many years before the disease recurs and comes back. These are probably complicated words, but I'll try to describe them. So when you are filling in this piece of paper, what I want you to think about is where does the data come from to help you find your phenotype? And so the word we'll typically use for that is the domain. So the domain is the type of data. Is it a condition, a drug, a procedure, a measurement? And then when you specify the domain that you're going to look in, we then need to specify a concept set, which is the expression of one or more concepts that represent that clinical entity of interest. This is what Mui was showing you yesterday when we were exploring the vocabulary to identify those specific terms. So you have a domain, you're going to say, I'm going to look in the condition table, and you're going to have a concept set, which is all the codes that make up endometrial cancer. And so you would say, let's find people who have a record in the condition table for any of the following codes that mean endometrial cancer. Now, some domains have specific attributes that you can also use. Just as a couple examples, the drug exposure table has information about how long you were exposed to the drug. And so you might say, let's find people who are exposed to the drug for at least 30 days. That would be an attribute there. Or the measurement domain, we have measurements that contain not just that a person had a hemoglobin A1C measurement, but you also have the associated value, the fact that the hemoglobin A1C was greater than 6.5%. And that value is an additional attribute. And so as you're thinking about this, you can think about, do you simply need the absence or presence of a particular concept, or is there something else about the concept that you might need to know? And then lastly, when we talk about temporal logic, what we're talking about is what is the time period that you're going to be looking for, usually in relation to your index event, that you're going to be looking for criteria to be satisfied. So if you say patients with endometrial cancer must not have prior cancers, then the temporal logic that I would ask for is, what period of time are you looking for to determine that they don't have prior cancer? Does that mean do not observe a condition of cancer in the prior 1 year before the index date, the prior 10 years, the prior 100 years? You have to be able to define that specific time period for every criteria that you come up with. All right, so I want you to take 5 minutes now to fill in this piece of paper by thinking about the phenotype that you have for your individual study. While you're doing that, I'm going to pull up on the screen a document that contains all of your questions, and we'll do one together. But pull out a pen and start working on your own phenotype to think through the inclusion, the cohort entry, inclusion criteria, and cohort definition. And as we look through the questions, then Kristin will walk you through how we can actually implement this in Atlas. So I should see this in Skype somewhere, Moe?
Yeah, I sent it to the three of us.
Okay.
So if you go to the three-person chat,
Yep.
I don't know if you can download it or not.
We're going to find out.
You're on his Wi-Fi,
It's trying. Oops, don't need R yet. You can use your laptop or mine.
I can use either. It seems
Do you
to be
want
performing well.
do you want me to go through do you want to just do the do you want me to do the Hep B and I?
Two hands if you're really excited.
I think it's the afternoon wane, I think, maybe. What's that? No. Not for this afternoon. Yes. So, whose question was, how many people infected with HPV will develop liver cancer? That was your question. Excellent. Could you tell us why are you interested in that question? That's great. That's perfect. So I like this question quite a lot. So in this particular case, the question is, how many people infected with HPV? HPV is that's not hepatitis B. I said that just a little bit. That's not what you mean. You mean HPV. What does HPV stand for? Hepatitis B. Okay. So infected with the hepatitis B virus. Okay. How many of them will develop liver cancer? So as specified, is a very well-defined problem, and it's a characterization question because we're asking amongst the people who have hepatitis B, what proportion of them go on to get liver cancer? So that would be the characterization question. It's a great place to start because do you have an idea of what that number is right now? We don't know. One thing we haven't defined here is the time period. So presumably you're saying will develop. So that must mean that you're thinking that there's a moment in time you enter the cohort for hepatitis B, and that there's also a moment in time that you develop liver cancer. So presumably there's some time that you're interested in looking for when those two things happen with each other. Like, are you interested in people developing liver cancer in 1 year after their hepatitis B, or 5 years, or do you not care about the time, or just eventually? Okay, that's fine. So we can think about what the time would be. But what's nice about this question is it seems to me you have two phenotypes that we need to define. Phenotype number one is find the people who have hepatitis B. And phenotype number two is find the people with liver cancer. So let's start with the first one. People infected with hepatitis B. How would you find them? What data elements do we think we need to use to find that? We're going to look for a blood test. So you're actually going to look for the positive value. Okay. How else could we find somebody who has hepatitis B? No. What other data? So one way to find them would be if they have a laboratory measurement of a positive hepatitis B test. Are there any other data elements you think you could look for to find people with the disease? What's that? Drugs. So there are several drugs that are antiretroviral therapies that are really only used for hepatitis B. So if you see a person who's taken one of those drugs, like I'm not even going to try to pronounce them. There are certain antiretrovirals only for hepatitis B. So if you see a person who takes one of those drugs, chances are they might have the disease because there's no reason they should get those drugs otherwise. So we could look at a measurement. There's an option of a drug. Any other data elements you might look for to find people who have hepatitis B?
Is it a condition that gets captured by your physician? It's not supposed to be a Dr. Seuss run.
So they can, but the gold standard is the blood test.
Mhm.
By observation, you have a skin yellow, you have some. I think there's a lot of signal we're looking for is the eyeball is pretty yellow. So
Yep.
that's when you have urgent infection.
So there could be a diagnosis code that could, a diagnosis could be recorded as a condition, which is simply a clinician observing that they think you have hepatitis B. And that may or may not be confirmed with a laboratory blood test. It may or may not be treated with a drug, but all of those are elements that we could potentially use to look up people with hepatitis B. Okay? Did you have any inclusion criteria as you were thinking about people infected with hepatitis B? Any specific people you were thinking about for that study? No? Okay. That's totally okay. So it makes very good sense to me that you might just want patients with hepatitis B, and that could be okay. Let's switch over to your second phenotype, liver cancer. And you two over there were studying hepatocellular carcinoma. I'm going to assume this is probably about the same thing. So how do you two think we should define hepatocellular carcinoma or liver cancer? What data elements are you going to look for?
It's so weird. You're talking and they're over there, their brains are passing the thoughts. I'm giving them a hard time. There are experts. But yeah, I heard you say, I think a diagnosis.
A diagnosis?
It's
So-
HTC, right?
So there's...
Does HTC get coded as a diagnosis code? Is it a series of things? Clinical attributes? I don't know. I'm not an oncologist, I'm just asking.
So we think that there might be a diagnosis, so we could look in the condition domain to try to find liver cancer. And specifically, interestingly, we have this phrase liver cancer. We also had this phrase hepatocellular carcinoma, which can be a very specific type of liver cancer. So we could think about diagnosis. Is there anything else that one might observe that would make us believe a person has liver cancer? Are there any measurements laboratory tests that tell you that a person has liver? So there may be some imaging that actually you can see the tumor. So that would absolutely be part of it. Any sort of treatments that patients with liver cancer get that might be strong indicators that they have liver cancer? What's that?
Decision of liver tissue.
So you could actually go look for the lesions in the liver itself. Yep. And so you might possibly see some sort of measurements associated with that, like particularly if they did like a biopsy or something like that. Yep. Anything else?
For surgical treatment, there are radiation treatment before they go to oncology drugs.
Got it. So there's surgical, radiation, and medical or pharmacologic interventions that are treatments that we could use following a diagnosis to possibly look for them. Most of those interventions are not specific to hepatocellular carcinoma, but if you saw a diagnosis and one of those things, now you probably believe that the person has the disease. Okay? Okay. All right. Well, so it seems to me that this is a very good clinical characterization question, and it seems like it's a simple, straightforward question where we just want to find all people who have hepatitis B, and we want to find all people who have liver cancer. So if we could create those two cohorts, then potentially with those cohorts in mind, we could answer your characterization question, and we might even be able to turn that into a prediction question to not just identify how many go on to have liver cancer, but maybe to identify which patients are going to be those patients that go on to get the cancer. Okay? So, Kristin, you want to tackle that one?
Let's do it. So I have a question, because I don't know, this movie seems like it's everywhere. Have you guys seen that Disney movie, Frozen? You know, there's that song, Do You Want to Build a
You realize there's
Snowman?
that song translated in Chinese as well.
Yeah, I don't know how to sing it in
That
Mandarin,
felt
but
right.
I'm gonna get Louis to translate it to a song, Do You Want to Build a Cohort? It has to be a cohort. There's no compromise here. It is a cohort. But let's start with, let me get it connected. Let's start with the first.
If you Google the Chinese version of Frozen, Let It Go,
Is it good?
play it. Yeah. It's
Well-
actually translated in like a ton of languages.
That's amazing.